In the previous session, we discussed regarding composition, various types of connective tissues like embryonic connective tissue proper with loose areolar and dense connective tissue, and the two components of the dense connective tissue, that is regular and irregular dense connective tissue, along with the examples. In this session, clinical aspects of the connective tissue will be discussed. Let us start with collagen diseases. Collagen diseases are a group of autoimmune diseases that occur when the body's immune system attacks its own skin, tissues, and organs, causing chronic inflammation in connective tissues. It includes rheumatic fever, rheumatoid arthritis, scleroderma, dermatomyositis, polyarteritis nodosa, and serum sickness. These are the diseases of connective tissue characterized by its fibrinoid necrosis. Let us see all these one by one. Rheumatic fever can result from inadequately treated strep throat or scarlet fever caused by bacteria Streptococcus. It causes inflammation, especially of the heart, blood vessels, and joints, leading to fever and painful tender joints. Rheumatoid arthritis is an autoimmune and chronic inflammatory disorder affecting many joints at a time, including hands and feet. Scleroderma is a slowly progressive rheumatic disease or autoimmune disease of connective tissue accompanied by vascular lesions, especially in the skin, lungs, and kidneys. It is characterized by deposition of fibrous tissue in the skin. This leads to thickness and firmness of the affected areas. Dermatomyositis is a rare disease that causes inflammation of the skin and underlying muscle tissue, involving degeneration of collagen, discoloration, and swelling. Polyarteritis nodosa is a rare multisystem disorder involving inflammation, weakening, and damage to small and medium-sized arteries. Blood vessels in any organ or organ system may be affected, including those supplying the kidneys, heart, intestine, nervous system, and or skeletal muscles. Serum sickness in humans is an allergic reaction to an injection of serum with proteins derived from a non-human animal source, which is characterized by skin rashes, joint stiffness, and fever. Now, apart from the collagen diseases as a group, the other disorders of connective tissue is as follows. Dupuytren's contracture occurs due to contraction of fibrous tissue of palmar aponeurosis. The disease results in flexion deformities of fingers, especially ring finger and little finger. Marfan syndrome is a hereditary disease affecting connective tissue, causing mesodermal and ectodermal dysplasia. It is characterized by excessive height, arachnodactyly, eye-arched palate, dislocated eye lens, and congenital heart disease. Ganglion is the swelling of the synovial sheath enveloping the tendons at the back of the wrist. Sprain or ligament sprain is the undue stretching and tearing of the fibers of a ligament due to an injury. It causes severe pain and effusion into the ligament and joint. The stability of the joint mainly depends on the integrity of the ligaments. Torn ligaments destabilize the joint and predispose the joint to dislocation. Tendon injury is rare, but if the tendon is ruptured or injured due to direct violence, they take long time for healing. Since only few blood vessels enter the tendon, nutrients, chemicals, and cells involved in tissue repair is delayed in reaching the injured site, leading to delayed healing. With this, we come to the end of the connective tissue. In the previous sessions, including this session, we have discussed the introduction, functions, components, general arrangements, classification, and clinical anatomy of connective tissue. In the next session, summary of the connective tissue will be discussed on the whole.